Welcome! Do you know what today is? Do you? It's the first day of medical terminology and the rest of your life. Yay! Whether you are bound for a career in medicine or just looking for something new and interesting to study, you've made a great choice with this specialization. Why, you ask? So inquisitive. I like that in a student. I can give you 3 good reasons for now. 1. Everybody has a body, and it will need healthcare at some point. A basic knowledge of medical terminology will help you navigate the healthcare system, from choosing the right specialist to making sure you understand the diagnosis. 2. It can lead to a job. Medical scribes are always in demand, and taking this course is a great way to learn not only terms, but also the skills to build and break down new terms that you may come across in your work. 3. It gives you the ability to advocate for the health of yourself and your loved ones. Being able to read medical records, pathology and imaging reports, and even prescriptions allows you to make informed decisions about what is happening and what needs to happen. For better or worse, you will have the knowledge and the skills to understand what is going on with your own health and the health of those you hold dear. If you're still watching this video, I'm assuming you're sold on the importance of the course. Smart move! So now let's talk some basic logistics and expectations. First, you should complete the modules and courses in order as the material builds on itself. The first module in Course 1 is unique as it includes basic knowledge and skills that you will need to retain for the entire specialization and for the rest of your life. No pressure, so much pressure. After the first module, we will use a fairly standard format covering 1 or more body systems per module. For Course 1, those systems include integumentary, urinary, and musculoskeletal. In general, you should expect to watch several recorded lectures, make flashcards, and take a quiz over basic definitions for each module. Exams will occur 3 times throughout the specialization at the end of each course. While they are not technically cumulative or comprehensive, you are learning a language, so the words and word parts from the course may be seen on future exams. Don't worry! They're fun. Really. Finally, please know a couple of things about me. I have a quirky sense of humor and I try to keep class anything but dull. However, if I ever say anything that you find offensive, please know that it was completely unintentional. I really do love people and my job. Also, I'm going to use the pronunciation for medical terms with which I am familiar. As with any language, there are regional variations and different preferred pronunciations. Potato, potato. Please know that while I will give you my best effort, you should adapt to any alternate pronunciations used by your supervisor or colleagues and embrace the change. Whew, I think that's it. Most students tell me this was one of the simplest but most useful courses they take. I hope you'll find it likewise. Yay for learning! Hi, my name is Laura Kabiri, and I'm a professor here at the beautiful Rice University overlooking the world-renowned Texas Medical Center. Small-town Texas born and bred, you'll often find me walking across campus in my dress and Western boots. I attended the University of Houston for my undergraduate education with a Bachelor of Arts in Music and a minor in biology. After graduation from U of H, I attended physical therapy school at Texas Woman's University, which provided my introduction to human anatomy with a full human cadaver lab experience. Dissecting every part of the human body was an invaluable learning opportunity, and I will be forever grateful to the people who donated their bodies for our benefit. What an amazing gift. As a licensed physical therapist, I worked for the Methodist hospital system in the acute care or hospital setting. I worked with everything from post-op joint replacements to strokes to flesh-eating bacteria-infected wounds. I loved working with the medically fragile and complex. During this time, I was blessed with twin sons, and I took a detour into academics as adjunct faculty. I quickly became addicted to teaching and went back to school to pursue a concurrent DPT PhD when the twins started kindergarten. They colored, I dissertated. It worked. In 2018, I was hired for my dream job at Rice University, and I've been here ever since. I teach human anatomy, physiology, and medical terminology, as well as other advanced electives. In my spare time, I like to build furniture in my woodworking shed, read inspirational historical fiction, volunteer in the community, and explore new cultures through travel, food, and music. It's taken divine intervention and a village to get me where I stand today. I'm so grateful for all of the help along the way and strive to pay it forward to others. In short, if you remember nothing else from this video, remember to embrace the journey of life and the people along the way. It may not go as planned, but I'm living proof it could turn out better than your wildest dreams. Welcome! I'm so glad you have decided to explore learning the language of medical terminology with me. Whether you are bound for a career in medicine or just looking for something new and interesting to study, you've made a great choice. Why, you ask? Let me count the ways. 1. Studying medical terminology can promote good health. Everybody has a body, and it will need health care at some point. Perhaps you will need advice on preventative care to remain healthy, medical care to address a disease or disorder, or rehabilitative care to recover from an injury. Regardless of the reason, we all encounter healthcare needs at some point. A basic knowledge of medical terminology can help you navigate the healthcare system. From choosing the right specialist to making sure you understand the diagnosis, speaking the language helps. Knowing which doctor specializes in treating which part of the body may prevent wasted time and money seeking a referral to a specialist through a general practitioner. Medical terminology can also help make a confusing diagnosis clear and even help you understand what kinds of tests, images, and referrals a healthcare practitioner might order. Empowering yourself with a basic understanding of medical terminology may also decrease some of the fear and uncertainty that can accompany interactions with the healthcare system. This decreased fear can in turn lead to increased confidence in your ability to obtain the proper medical attention, which may also increase the likelihood of seeking out healthcare and promoting good health. Ta-da! Studying medical terminology can promote good health. Studying medical terminology also promotes effective communication between a healthcare provider and the patient. Have you ever been surrounded by people who were all speaking a language that you did not understand? I have. It can be very confusing. What might be a kind word can sound like an insult. The inability to understand what people around you are saying can create a sense of paranoia. Wait, what did you just say about me? Not speaking the language can also make it more difficult, if not impossible, to tell people what you need. If you have ever seen a toddler having a tantrum or been the recipient of their wrath, you know the importance of being able to communicate your needs and the frustration of not being able to do so. The same holds true with the language of medical terminology. Perhaps you need to be able to clearly express your symptoms to your healthcare provider who just isn't understanding what you're trying to describe. This course can help. Perhaps you already speak medical terminology in your native language but are seeking to provide healthcare to the English-speaking population. This course can help. Whether you are the future healthcare provider or the current patient, studying medical terminology promotes effective communication. And now for a 10-second brain break. Are you still counting? So far, I have given you 2 reasons why you should study medical terminology: health and communication. But wait, there's more. Reason number 3, using medical terminology properly earns respect. Have you ever had a friend, colleague, or love interest who spoke a different language? I have. Learning the basic greetings and phrases like hello, please, thank you, yes, and no in their native language was one of the first things I did to show respect for them and their culture. Even if I did it with a thick Texas accent, they knew I was trying, and I got better with practice. Or maybe you were the one who spoke a different language. How did it feel when someone expressed interest in learning to communicate with you in your native language? Even if they didn't do it perfectly, the sincere and honest effort mattered, right? Just like communicating with someone in their native language, using medical terminology with a medical professional tells them that you understand their background and are attempting to relate to them on a deeper level. This can allow for more open, meaningful conversation. Even if you can't speak medical terminology fluently, being able to understand and repeat the medical terms correctly in layman's terms shows respect for the language. It can also build the healthcare professional's respect for you and your ability to understand the situation. Using medical terminology properly earns respect. Number 4, studying medical terminology may lead to a job. Whoop, whoop. Have you heard of medical scribing? A medical scribe is someone who assists a medical professional, usually a physician, by gathering and documenting information from the patient's visit in an electronic healthcare record. A solid foundation in medical terminology can be an asset on your medical scribe resume. Beyond medical scribing, perhaps you want to work in a healthcare office or volunteer with a healthcare organization. Studying medical terminology may help you during interviews and make you feel more comfortable and confident in your work environment. Taking this course is a great way to learn not only the medical terms themselves, but also the skills to build and break down new terms that you may come across in your work. Nifty. Official disclaimer, please note that this course does not in any way guarantee employment, but building medical terminology skills may help you feel more confident in applying for healthcare positions and could be an attractive addition to your resume. So cultivate those skills and watch them grow. Finally, the fifth reason to study medical terminology is to facilitate the ability to advocate for the health of yourself and your loved ones. Being able to read medical records, pathology and imaging reports, and even prescriptions may help you make better informed decisions about what is happening and what needs to happen. For better or worse, you can have the knowledge and skills to understand what is going on with your own health and the health of those you hold dear. As with all good things, this lecture too must come to an end. Thanks for exploring why you should study medical terminology with me. See you next time. Welcome! I'm so glad you're joining me today. In this lecture, we will continue our exploration of medical terminology by looking at common word parts found in medical terms. Specifically, the language of medicine is made up of three main building blocks: root, suffixes, and prefixes. Let's start by taking a closer look at the roots in medical terminology. Just like roots are the foundation of a plant, a root in medical terminology is the foundation or subject of the medical term. It also rhymes with boots and hoots. Get it? Hoots, like an owl? Go Rice! Roots tend to function like nouns in the language of medicine. They are often followed by a combining vowel signified by a slash and the letter O. We will talk more about combining vowels later. Get excited, people! I know. You can't wait? Me either. For now, just know that the presence of a combining vowel tells us that the word part is a root. Some meanings may have more than one root. For example, hemo and hemato both mean blood. Also, root words with the same meaning can be spelled quite differently. Consider angio and vaso and vasculo, which all mean vessel. There are many common roots for which you will be responsible in this course. They should be committed to memory as soon as possible. Before continuing with this lecture, please click on the link to access a list of roots that should be included in your flashcard deck for this module. Did you really click on the link? Really? Or did you squirrel? Squirrel! Where? Oh, just a picture. Back to suffixes. While a root is the foundation or subject, a suffix is added to the end of a word in medical terminology to provide meaning. Like a caboose on a train, suffixes are found at the end of a medical term. They give essential meaning to the term itself. Simple suffixes are basic and are used to turn a root into a complete word. They might make the root an adjective, a noun, or a diminutive version. Diminutive versions are smaller versions of the term itself. They function similar to cute versus cutie in the English language or hijo versus hijito in Spanish. They change the root to mean something small. Aren't you just the cutest little root that ever lived? Yes, you are. Yes, you are. As with roots, there are many suffixes for which you will be responsible in this course. They also should be committed to memory as soon as possible. Before continuing with this lecture, please click on the link to access a list of suffixes that should be included in your flashcard deck for this module. For real. Do it now. Opposite of a suffix, a prefix comes at the beginning of the word, like the engine of a train. Toot, toot. Prefixes are not always necessary in medical terminology. When needed, they are added to the beginning of a term to further modify the root. There are also many prefixes for which you will be responsible in this course. So many responsibilities. Can you do it? Of course you can. To conclude this lecture, please click on the link to access a list of prefixes that should be included in your flashcard deck for this module. Thanks for exploring common word parts of medical terminology with me. This train is leaving the station. Bye. Bye-bye. Bye-bye. Bye. Welcome. In this lecture, we will continue our exploration of medical terminology by looking at how we can take parts of medical terms and use them to translate and build entire words. The best part is you don't even have to know the word to translate or build it. Medical terminology is all about being able to put the parts together. So far, we know that medical terms are made up of parts called roots, suffixes, and prefixes. But you might have noticed that roots in medical terminology often have a /o at the end, whereas suffixes and prefixes do not. Let's start with a look at roots and why they're different from other word parts. Roots in medical terminology contain a /o, known as a combining vowel. The combining vowel is added to more easily combine the root with other word parts. The O can be thought of like the little bumps on the building blocks shown here. They help link one part to another. A combining form is what we call the root plus the combining vowel. The example combining form of a root shown here is cranio. Sometimes we want to include the combining vowel in the new medical term. Here we provide the first of two main rules for building terms that keep the letter O. Keep the combining vowel if you are joining a root to a suffix that begins with a consonant. For example, the combining vowel remains when joining entero to logy to form enterology, or the study of the intestines. Yum! You also keep the combining vowel if you are joining any two roots together, even if the second root begins with a vowel. For example, the combining vowel remains between the roots gastro and entero in the word gastroenterology, literally translated as the study of the stomach intestines. Do you see all of the O's? Even though entero begins with a vowel, we keep the O in gastro because we are combining two roots. However, we don't always want to keep that combining vowel. Sometimes we want to drop it. Drop it! Good doggy. Good job. Here we provide the rule for building terms that drop the letter O. Drop the combining vowel if the suffix begins with a vowel. In these cases, keeping the vowel would make the word more awkward to pronounce. For example, the surgical removal of the stomach is called a gastrectomy. The root is gastro and the suffix is ectomy. Because the suffix begins with a vowel or the letter E, we drop the combining vowel O to make gastrectomy. Otherwise, the word would be gastroectomy, which just doesn't work as well. And now for a 10-second brain break. Now that we know that roots have combining vowels, we will look at how we can use parts of medical terms to help translate entire words. In order to be able to understand the meaning of a medical term, it is important to be able to break it down into its parts and then translate them methodically. Easy peasy. The first step in translating a medical term is to break down the word into smaller parts. It makes it less intimidating and more manageable to consume, just like eating a watermelon. How do you end up eating the whole thing? One slice at a time. Delicious. Most medical terms have at least a root and a suffix. Many will also have a prefix, and some will even have multiple roots. But don't worry, the rules are the same no matter how many parts a term has. Step 1. Break down the big word into smaller parts. Suffix, root or roots, and prefix, if there is one. The second step in breaking down a medical term is to translate the suffix. That's right. Translating a medical term is just like reading a good book. Start at the end. Wait, you don't read your books that way? How do you know what's going to happen? When translating a medical term, it is customary to say the meaning of the suffix first. Don't believe me? Consider the word psychology. Logy is the suffix and means the study of. Psychology is translated the study of the mind. See? Suffix first. Otherwise, it would be translated the mind the study of. Step 2, translate the suffix. The third step in breaking down a medical term is to translate the prefix. Yep, we start at the end and then go back to the beginning. After translating the suffix, return to the starting line and translate the prefix. But what if the word doesn't have a prefix? No problem. Skip right through this step and move on to step 4. The fourth step in breaking down a medical term is to translate the root or roots. Just like roots anchor a tree, roots in medical terms anchor the meaning. They come last in translation and hold that term down. If a term has more than one root, you translate the roots in order of appearance, left to right. Step 4, translate the root or roots. The last step in translating a medical term is to put the parts together. Don't forget to put them together in order. Suffix, prefix, if there is one, root or roots. Step 5, put the parts together. Let's try it. This medical term contains a prefix, root, and suffix with which you should already be familiar. How did you do? Let's find out. When we break down the word, we get the prefix tachy, the root cardi, and the suffix ia. Next, we translate the suffix. Ia means condition. Then we translate the prefix tachy, which means fast. Finally, we translate the root cardi, meaning heart, and put them all together in order. Condition of a fast heart. Yay-yo! Tachycardia means an abnormally fast heart rate. Condition of a fast heart. Well done! Want to try another one? Sure you do. This next medical term also contains a prefix, root, and suffix with which you should already be familiar. How did you do? Let's find out. When we break down the word, we get the prefix sub, the root cutane, and the suffix us. Next, we translate the suffix. Us means pertaining to. Then we translate the prefix sub, which means beneath. Finally, we translate the root cutaneo, meaning skin, and put them all together in order. Pertaining to, beneath the skin. You did it again! Subcutaneous means pertaining to, beneath the skin. If you get a subcutaneous injection, they are injecting something beneath your skin, like some injected medications. Well, I think you've got it, but keep practicing. Just wait and see how many times you get to use this skill in the course and the rest of your life. Go forth and translate terms, people. As with all good things, this lecture too must come to an end. Thanks for exploring how to translate medical terms with me. See you next time. Welcome. In this lecture, we will look at how information is organized in medical records, learn common terminology for body orientation, and finish up by looking at a few abbreviations. Ready, set, go! Health records come in different lengths and formats. You may hear them referred to as an EHR, or electronic health record, or an EMR, or electronic medical record. The EMR is like the patient's chart from a single clinic or practice visit, while the EHR is more global and holistic, with information from multiple doctors over multiple visits. In this video, we will focus on the medical records that you might see as part of the larger health record. While the detail and content of a medical record may vary based upon the type of healthcare practitioner and setting, there are some common elements. The first common element in medical records is the chief complaint. It is the main reason for the patient's visit. It might include things like sore throat, pain in a joint, or a rash. The second common element in medical records is the history of present illness. It is the story of the patient's problem. It usually includes things like when the symptoms began and if there was a particular event that caused the symptoms, like slamming your fingers in a car door. Been there. Ouch. Review of systems is the next common element in medical records. It includes a description of individual body systems in order to discover any symptoms not directly related to the main problem. It's also just part of good practice. In other words, even if you go to the doctor with an eye complaint, they are also going to check your heart and lungs. Other common elements of medical records include the patient's past medical and surgical histories. You've probably answered questions about these every time you've gone to the doctor. PMH, or past medical history, tells the healthcare provider if you've had any other significant past illnesses like high blood pressure, asthma, or diabetes. Your past surgical history lists any previous surgeries. There are two commonly accepted abbreviations for both past medical and surgical histories, as shown here. The patient's family and social history are also common elements in medical records. The family history checks for significant illnesses that run in the patient's family. The social history includes a record of habits like alcohol, drug, and tobacco use that can impact health. It may also include information on a patient's living situation and support available to them during their illness. As with past medical and surgical histories, family and social histories also have two commonly used abbreviations. If you haven't found the pattern yet, history can be abbreviated as simply a capital letter H or a big H followed by a little x. Potato, potato, they both mean the same thing. As we continue our discussion of medical terminology, it is important to discuss the organization of information within a medical record. One commonly used method of organizing information is the SOAP note. SOAP is an important part of good hygiene. Life tips with Dr. Kabiri. You're welcome. However, SOAP is also an acronym for the 4 different types of information documented by healthcare providers in a medical note. S stands for subjective, O stands for objective, A stands for assessment, and P stands for plan. The S in SOAP note stands for subjective. In medical records, this section includes what the patient says. If something is subjective, that means it is influenced by a person's opinions, feelings, or preferences. Perhaps that can help you remember that the patient's thoughts, opinions, and how they feel belong in this section. That might include things like the chief complaint, symptoms, abbreviated big S little x, history of present illness, past medical and surgical histories, family history, and social history. Important! This section should record exactly what the patient says, even if it doesn't match what the clinician thinks. That part comes later. S is for subjective. The O in SOAP note stands for objective. And medical records, this section includes what the tests reveal. If something is objective, that means it is not influenced by personal feelings or opinions, but rather represents fact. It is not biased by human emotion or thought. Perhaps that can help you remember that the findings of medical tests and examinations go in this section. Things that should be included in the objective section include findings from the physical exam, abbreviated PE, and review of systems, as well as the results from lab work, tests, and imaging like X-rays, MRIs, or CT scans. O is for objective. The A in SOAP note stands for assessment. This section contains the practitioner's assessment of what is causing the subjective complaints and objective test results. We call this the diagnosis, abbreviated big D little x. Sometimes a patient might not have a clear diagnosis. In this case, the practitioner may include a differential diagnosis, abbreviated DDX, which is a list of possible conditions that might be causing the problem. I've been a medical mystery several times in my life. I like to do my part to keep healthcare providers thinking. Either way, the diagnosis or differential diagnosis go in the assessment section. A is for assessment. The P in SOAP note stands for plan. This section obviously tells you what the practitioner plans to do about their findings. The plan includes the treatment, abbreviated big T little x, which might be a therapy or prescriptions, abbreviated big R little x, or surgery. Referrals to or consults with a specialist should go in this section, as well as any additional tests that might be needed to help clarify or confirm a diagnosis. P is for plan. And now for a 10-second brain break. We will now